So, yeah, we came by. This is some family members of loved ones from the jail over there. And, I mean, there's deplorable conditions. I think we have a little bit of a list.
I have names of people that are in jail. They're incarcerated right now. And these are names of people that have COVID. And they're in there with people that do not have COVID.
So they're mixed together.
They're cross-contaminated the people. And this is coming from people that's inside. I have my nephew in jail. I have family members in jail. I have people, friends. You know what? They're all in jail. There's 6 names right here of people that have COVID. They're in there with inmates that don't.
Okay, so what I can do, let me introduce myself first. My name's Kristy Michie. I'm the Assistant Director of Public Health here. I'm happy to listen to your complaints. I can take them down. I can take notes. I can review them with Dr. Moreno when he returns. He's not in the office this week, but he will be back next week. In the meantime, I can also have conversations with the jail. I do want to let you know that we do not have oversight and authority over the jail. So while I can bring your concerns to leadership at the jail, I can't promise you any action. I don't have the authority to go in and make changes there, but I can elevate your concerns to them. So I just want you to be aware of that at the start of our conversation. So
you can get us in, or we have to keep us in. In other words, like, I understand, we get it.
Okay.
Yeah, we understand.
Okay. So I mean, if you have things written down, I can take that copies, or I can take them down myself, whichever works. Whichever. You said you had some things. If you can give them to me, or you want me to write them down, whichever works best.
Could take a picture of it.
I would like I want this. Just you can copy it. So this is these are the names of the inmates that have COVID. They have COVID. They're positive.
So
this right here.
Oh, I'm sorry.
Right
So who do we have to talk to in order
names
to,
right here.
yeah.
who can we talk to so
well,
that
I mean,
actions can
I'm hoping that you know, this hopefully sparks launch an investigation to at least check that minimal standards are being met, you know, and protocols, everything else, you know, safe staffing. There's a lot of issues that need to be audited, you know, and that I think is within the realm if the board directed the health department to do so.
He's cross-contaminated in there right now. I'm afraid to lose my nephew as well, you know. It's not fair. I lost my cousin. I'm not trying to lose anybody. I'm not trying to have anybody else in this world lose anybody due to somebody not being given the chance of attention, medical attention. They say that they're following all the guidelines, they're not doing their job.
You mean a different pod or a different?
Yeah, it's because they're not gonna make it if they're not getting treated well.
So that's our huge concern, that, you know, they're being very negligent towards like the whole COVID situation. Like they're not respecting the rules and regulations, you know, like they're not exactly.
They're not following
so it's
guidelines.
like, you know, they're putting everybody's lives in danger, including staff, because I mean, if inmates have it, then it's gonna happen to the staff members as well, or vice versa, you know. So to us, it's like, okay, you guys are mandating out here for everybody 6 feet apart, masks, do this, do that, but in there they don't have that, you know. And we all believe that our rights out here is the same rights that they have. Yes, you know, they're paying for their crime, however, they're still human beings, you know. And, you know, they're really doing this hunger strike in reality because they want to be heard, because nothing's been done, you know. And like, she just lost her cousin in there due to COVID, and although they don't want to admit to that, it was COVID, you know. There was, even with my husband,
my cousin would never take this
including
on
my husband, like, you know, he got really, really sick. He reported it, which with a lot of others as well. They were like, you know, constantly saying, hey, I need to see I need medical attention. It never brought, they never came to get them or check them out. And, you know, yes, I understand that the officers or deputies are, you know, they go in there to check them every 50 minutes, but they're going in there not doing anything, you know. And so it's kind of like, okay, yeah, they couldn't say, yeah, we go in there, check them out. Okay, but what are you doing for them when they're telling you they don't feel good? They're not doing anything. You know, I've made reports inside there, like in the front staff. I spoke to a surgeon himself, promised me that a nurse was going to go see my husband, never came, never went. And I'm pretty sure it happened to a lot of others, you know. So how are they taking care of them in there, you know? Also, the staff, when they go in to see the inmates, they don't switch their gloves. They're not switching their gloves. They're using the same gloves that were out there being used, touching who knows what, and they walk in there with them. So they're supposed to change them. our very huge concern too, when Sergio passed away, rest in peace, they didn't disinfect anything. They didn't give them anything to disinfect anything. So, you know, where is the safety of theirs too, of them too?
How is that following the CDC
Yeah.
guidelines?
So it's a really huge concern. What's going to happen to until everybody in that county jail is like, you know, really, really sick and even more deaths occur? That's when it's going to stop. So it is a huge concern for us. You know, they are loved ones. They're our fathers. They're our sons. They're our everything. You know, they're suffering. We're suffering. You know, we fear for their lives. You know, it's like I think we fear more for their lives in there than what we fear for ours out here. You know, so who's taking care of them? Who's protecting them? So even like with the like insurances out here, I know that they have medical insurance, you know. They even, you know, so it's kind of like, where is theirs? You know, so we want protection for them. We want, you know, we're their voice out here.
Yeah. We have rights as well. We're out here, we have rights. As well as when we're in there, we still have the same rights as being human beings. Even we have rights, our civil rights, the 14th Amendment as well. You know? That's exactly what it is, the 14th Amendment. Everybody should be treated equally. Their rights should be treated equally. No matter if they're enslaved, no matter if they're in prison, no matter what. If they were born a U.S. citizen, that's their right. How are you going to take that from them? And then misguide everyone out here. Like they're lying to us. They're only letting us feel and think that they're doing what they can. They're not doing what they need to be doing. My cousin's life is proof.
My son Sergio was the one that passed away. When I went to the funeral home, they gave me all his belongings, and I couldn't believe what he had in there. They gave me his sheets, they gave me his overalls. What would they give me that? That's kind of stupid, you know. They should have kept that or burn it or whatever. So they gave me his overalls, they gave me his sheets. They gave me his blanket, but the only thing I didn't see was any sanitation, no mask, no nothing.
Every
nothing
time
at all.
video
And
FaceTime
his
my
clothes,
cousin,
the clothes he was wearing, and that's it.
they
Other
never
than
had
that,
any
no
masks.
sanitation, no hand creamer, no nothing. I mean, no mask. I mean, he should have had it. If he had everything in there, that should have been in there, and there was nothing in there. What I did, I just threw everything away. Why would I want that? Why would they send me? I'm sorry. Why would they send me his inmates? Same thing. I mean, come on, give me a break.
It's like
I
throwing
mean,
it in
people are
their
hurting.
face.
You know, that's the way I feel. I think they're totally
Like they're laughing at us.
they're like they don't have no sensitivity towards people.
And they were saying too, they were saying too that they're not washing their blankets for them. They're washing them every 5 months.
Every 5 months. And
Yes,
that is
every 5
We
months.
really need changes in there because the system's never
Yeah.
gonna change if we don't do anything
It's not
about
gonna
it.
get well, it's gonna get even
It's
worse.
not
They're
gonna
not doing
change.
their sanitation. Nothing.
I have a title right here that's got a long statement from one of the inmates inside asking for a redress of grievance, and I don't know if it'd be easier for you to just take the title.
I should have kept it for
Is it
it.
someplace that I can access it
Yes,
on
it's
the
on
internet?
YouTube. So you just Sergio Guzman Gonzales dies of COVID at Monterey
We're
County
definitely
Jail.
starting soon.
And my cousin was a healthy person. He always stayed motivated to work out every
exercise
morning.
every day.
Yeah,
and
that's
he
what my
always
husband was
clean.
telling me that,
Clean.
yeah.
I mean,
He would get us
I'll
all
read a
up
little
to
bit.
it, like no matter what. He would tell me, like, get
It
your
would be
lazy ass up,
October
no matter what, like, no,
19th.
you
And he liked to
2021.
work out, and he always looked to be healthy. He always
All the
would clean
time.
himself, brush his
And
teeth,
he
He
says,
always
He
kept
was
this
always
is
himself
why we're
well.
pushing for the recognition of
way he
the
looked
infractions
at
that
him.
occurred
So
here
for him
in regards
saying
to
that
the
maybe he
unlawful
committed
death of
suicide.
Sergio
No.
Gonzales on September
Because he was
24th.
healthy. He liked to
This
Somebody
was
else would have
negligence and
seen that.
disrespect in regards to the state
And how did he
mandated
commit
It's-
COVID-19
suicide? What did he
like
do?
regulations
How did he
policies.
commit suicide? What did
Yeah.
he take? What did
He
he
actually
do?
has
Never
pretty
do that.
detailed
Exactly.
information.
Even being out here, no matter
We're
what, he
asking
could
that
hit
at
rock
this
bottom
time, Monterey
so
County
many
Jail
times that
for
he could
any and
never
all
think
data
that.
and information
Never.
pertaining
But
to
it's like,
Sergio
where's the proof?
to
Okay,
be
he
rendered
commits suicide. What did he
for the
do?
whole year
What did he-
actually
how did he
show this
take
man's
his life?
capable endurance,
No
able
questions
to
how?
work
Where are the
out. Some
answers? Like,
people
where are the
want
proofs
to
that
20
he
plus
committed
years.
suicide?
They've
What
known
did he
for
do?
it to be motivated
Yeah.
physical.
And they're saying,
So
yeah,
Not
he
drugs,
did
not nothing.
nothing but
Did he
great
hang
health
himself? No,
conditions
from
to
where?
be
They
able
would
to
have
be
seen. They're all in a
released.
dorm.
Yeah, everybody would have seen it.
It's
They would have
so
used
So,
to take pictures.
and then he says
Exactly. They wouldn't
they
have
was
even
placed in
like,
My
quarantine
cousin was well loved in
for
there.
6
and
days.
I
7
know
of
a
the
lot of
members,
people,
a
more
total
than
of
a
8
handful,
that
more
got
than
quarantined.
my
They
handful,
were brought
all
back
of our
6 days
handles
later, which
that were
mandate
around my
says
cousin
they
and
should be
respected
14
him
to
and loved
21
him the
days
way
in
we loved
quarantine.
him.
That was not done. They brought them back. They said, hey, they're all contaminated anyway. Deal with it. Is what the actual slogan from one of the
Yeah, they
deputies.
took him only for 5-6 days and brought him back with everybody else.
You're supposed to quarantine at least 14
They
or 21
didn't.
days. They didn't quarantine them that.
And
They didn't give them that.
That's
So there's a lot of grievance.
They also brushed off my cousin's COVID as a common cold. Like, no, it's a cold. You'll be all right. Like, how do you figure? How do you know? If you didn't give him that attention, how do you know it was a common cold, a regular cold? How would you know it was COVID? Or how would you not know it was COVID if you weren't giving him the medical attention he needed?
So, I feel
You have a
very much
list?
for your concern for loved ones. Doesn't matter whether they're home or someplace
What about
else.
what the inmates are requesting?
So
I have a list right here because I can give you all that. That's what they need in there. My cousin, he did pass away. But you know what? If that's what it takes for them to open their eyes, then so be it. My cousin's gonna make a movement. He is. He doesn't even know. He could be turning in his grave for all I know. Because if I were to go and tell him, he would never believe it. My cousin's gonna do a lot, and I'm gonna help him. And here's what the inmates are requesting.
is there a way that you can email that to me?
You can't write it all down.
I can try. It's quite a bit. So
I could read it to you, and you can write it as I read
Well-
it to you. Yes, there is a lot, and it should be written down because the only way I feel is if it's gonna get forwarded to somebody else is if you write it down on your paper.
Well,
You
I'm
can tell
happy-
me, email it to me, do this or that, but you can also disregard and delete my emails. You know what I'm saying? I would rather see you write it down and you take it with you on a piece of paper, and I'll be okay.
That's fine. I just want to make sure that I capture everything.
Okay, so the first bullet says, for the medical guidelines to be brought up to date. Next bullet, to post or let inmates know what the jail COVID-19 guidelines and process is.
Just too fast.
To post or let inmates know what the jail COVID-19 guidelines are and what the process is.
And then they also said we can visit them more. And then by law, we
Next
have
bullets
to
for
have
better
big
medical
phone
treatment.
calls. They don't. They don't. They tax so much money just to talk to them.
Next bullet,
And they're not even doing anything for them
for
inside.
medical staff to respond in a timely manner. Next bullet is long. For medical staff to pay attention to the medical orders and diets that are on file for those inmates. Who require a special diet such as those who are diabetic or have heart problems or have allergic reactions to certain foods. In parentheses it says inmates are constantly having to remind staff
Look what somebody told
about
me.
the orders. Doctors do.
Sorry, constantly having to remind
Having to remind staff about the orders,
this,
the doctors
like the communities and
wrote that is in their bio. For deputies, classification, and staff to have
Like deputy for deputies.
classification
Classification.
and staff to have body cams in place. Next bullet. For classification to stop for classification to stop misusing their authority by criminally charging inmates. for classification to follow procedures. And give in-house violations or DARs. The next bullet. For classification to stop the injustices inmates are being charged.
Did you see what I sent to the group chat?
For phone calls.
Which one?
The group chat.
Yeah.
Look at the paper. Yeah, look at the last person calls.
I believe it's what you went. What part are they in? The F?
Huh?
What part are they in?
It's C and D.
Okay, so
C and D dorm.
okay, so this one's for classification to back off C dorm inmates
And that's it.
as they are the only ones being watched closely at jail. Next one is for classification to stop over abusing their power. That's cool. Inmates throughout the whole facility want to be able to have the same programs as mainline such as being able to work and get an education and canteen.
I'm sorry, no, last one is and.
Canteen. Next bullet. Inmates in C dorm inmates in C dorm were interrogated recently with whites and paisas as it ran smoothly. With white people and with Mexican people as it ran smoothly. Okay, next bullet. Inmates in C dorm were interrogated recently with whites and paisas or as Mexicans as it ran smoothly. Next bullet.
I'm sorry, the last part. As
Inmates in C dorm were integrated. Sorry. Recently with whites and Mexicans, and it ran smoothly. There's three more. Next, for jail to provide each unit with cleaning and sanitizing cleaners. So the units can get cleaned more than once per week.
Stay there for them to pick them up and take them to the hospital.
Especially with COVID going around.
So the right thing would have been for them to take them straight right away to the hospital. Then they took forever.
Like how long did it take them to take us to
Would like staff to be more considerate of the elderly. And provide them with an extra blanket as winter approaches, or provide thermals for all inmates during the cold season. as they will get returned when the warmer season approaches. The inmates in C dorm are not only asking for these requests for themselves, but are doing it for the whole facility, for all inmates.
I don't know if you want to write this down too. It's just some, like the two amendments that he said to write down. Or did you give her that?
What?
The amendments that they're violating?
The 14th Amendment.
The 14 and 8. So it's the violation of 14th Amendment and 8th Amendment. COVID-19 negligence for living conditions, cruel and unusual punishment, 1 hot meal per day only.
I'm sorry, that's too fast.
Oh, sorry. So violating our 14th Amendment and 8th Amendment, and then COVID-19 negligence, poor living conditions, cruel and unusual punishment,
And she's giving me all this information, but Tanya and her are like messaging. And she told me that it's
1 hot meal per day only, overpricing canteen, and then what she had said. Yeah. So then, so you're gonna give all this, you're gonna put a report in, like all this information, you're gonna pass it down to, you said Dr.
Pass it up.
Well, yeah.
Is I'll share it with the Sheriff's Department.
Okay.
And the County Administrative Office. So what I'll do is I'll type it all up in a memo, and then I'll send it to the CAO's office and the Chief Administrative Officer's office and the Sheriff's Department.
Okay.
Do you want to leave your names with me?
Yes, yes, please. Patricia Camacho.
My name's Cassandra Ordonez. Sergio was my cousin. So we will get justice. I'm not gonna stop till we get justice. Then my aunt,
The mother of Sergio Gonzales, Isabel Gonzales, the one that passed away. Mother of Sergio Gonzales.
My name is Angela Diaz.
Well, I want to thank you for coming down and sharing your concerns. I know it's not an easy subject for you right now. It's a hard time for families, but I do appreciate you coming and sharing this information with me. Like I said, I can't promise any action, but I can say that I will share your concerns.
as long as you share our concerns with the right people, that's all we want. That's all we can hope for right now.
I would also be happy to share a copy of what I send. Is there an email address
Yes.
that I can send it to so you know exactly what was passed on?
We're trying over here, like,
Appreciate you all sharing your
someone
stories.
else is
for them
doing
and
something
them.
else.
Thank you.
Thank you for listening to us at this point.
Is there any number where we can contact you as well to like
Oh, yeah.
follow up and see?
Getting there.
Oh, sorry.
Thank you.
Thank you so much.
And that's my direct number on there, so
Okay,
it doesn't go to the main number.
Wonderful.
Okay,
Thank
we
you.
really appreciate your time. Thank you so much.
You're the only one that's come out to speak
Yes.
to us so far, and we appreciate it very much.
Yes, thank you. No, thank you so much. We appreciate it. Thank
Thank
you.
you.
Have a good rest of your day.